Welcome to the training on occupational health, environment and safety. Let us learn the module on first aid for animal bites. Before we begin, let's take a look at the key learning objectives. After completing this module, you will be able to explain animal bites and differentiate minor and major wounds caused by animal bites. Demonstrate first aid to be given for animal bites. Explain preventive measures for animal bites. Let's first find out what an animal bite is. Animal bites can produce nasty injuries and infections, especially in young children and babies. Let's first find out what an animal bite is. Animal bites can produce nasty injuries and infections, especially in young children and babies. Domestic pets cause most animal bites. Dogs are more likely to bite than cats. Bites from non-immunized domestic animals and wild animals carry the risk of rabies. Rabies is more common in bats, raccoons, skunks and foxes than in cats and dogs. An animal bite carries the risk of transmitting tetanus and rabies. Let us see the difference between minor and major wounds by an animal bite. Minor wound. Where the bite barely breaks the skin, it can be treated with some basic home care. Major wound. Bites that are deep or cause tearing of the skin or that become infected need to be seen by a doctor. First aid for minor wounds. To know more. Step 1. Using clean water with soap or an antiseptic product if possible, wash the wound thoroughly. Make sure to clean the area around the wound thoroughly as well. Step 2. Apply an antiseptic cream to prevent infection. Step 3. Cover the wound with a sterile wound dressing. Action to be taken for animal bites is different in different images conditions. To know more. Let us see. For deep wounds. If the animal bite creates a deep puncture of the skin or the skin is badly torn and bleeding, apply pressure with a clean, dry cloth to stop the bleeding and see your doctor. For infection. If you notice signs of infection, such as swelling, redness, increased pain or oozing, see your doctor immediately. For suspected rabies. If you suspect the bite was caused by an animal that might carry rabies, see your doctor immediately. See a doctor without delay if the bite creates a deep puncture wound or the skin is badly torn. The bite is on the face, hand, foot or neck or over a joint. The person bitten has not had a tetanus injection within the past 5 years. There are signs of infection. You suspect the dog may be rabid. Let us see how we can prevent animal bites. Avoid keeping wild animals as pets. Choose a pet that is friendly to children. Train the pet to obey commands. Vaccinate your pet. When children are around, pet supervision is required. Avoid leaving infants alone with pets.
How to treat a cat or dog bite. The bites of dogs and cats can lead to infection if they are not treated promptly. Here are some first aid measures. You will need soap and water, a towel, an antiseptic solution, an antibiotic ointment, a bandage, elevation, and a doctor. Step 1. Wash the wound with soap, warm water, and a towel. This will remove dirt, saliva, and bacteria. Apply pressure to the wound to stop any bleeding. If the bleeding persists, seek medical care. Step 2. Apply an antiseptic solution such as iodine to the wound after you finish washing. Then, apply an antibiotic ointment and cover the wound with a sterile bandage. Reapply the antibiotic ointment twice a day until the wound heals. Step 3. Keep the injured area elevated to slow swelling and prevent infection. Step 4. Seek professional medical care if bleeding continues, if a bone appears broken, if you have a compromised immune system, or if you've been bitten by a stray or feral animal. Follow your doctor's course of treatment, and above all, be well. Did you know? The jaws of a large dog can exert a pressure of as much as 450 pounds per square inch.